So before we really talk about restorations or cavities, I think it's important just to quickly go over what does a tooth actually look like. So this is what the typical decay in between the two teeth kind of looks like. You can see it starts on the outside, and it's a little small. It's not too wide, but as it goes past these harder enamel layer, it gets into that softer layer, and all of a sudden it mushrooms out. It's because the dentin is softer and it has lots of little tubules, little holes. There's lots of room for bacteria to grow and reproduce and make more acid. So once it reaches to the dentin layer, that's when the cavity gets really big really quickly, and you can see the stain going straight towards the nerve of the tooth. So that's kind of what a cavity will look like inside the tooth and how it progresses. And obviously, dentists and doctors love to classify things. So we classify a cavity where if it's just inside the back of a tooth or on top of a tooth, and there's tooth all the way around it, we call that a class 1. If the cavity is in between the molar or in between the two teeth, we call that a class 2. And if the cavity is in between the two front teeth, we call that a class 3. And if the cavity is in the corner of a front tooth, we call that a class 4. And if the cavity is actually on the side of the tooth near the gum area, we call that a class 5. Those are the ones that a lot of patients will say, it's really sensitive. I think there's something going on along my gum's receding. So those are a class 5. And of course, the last but not least, but if you broke off a corner of your molar, we call that a class 6. Okay.